As the weather gets colder, the illnesses start appearing, including RSV. It's a common illness among infants and the elderly, but for some it can be serious and require hospitalization. Thanks for joining us. I'm Katie Koppel in for Larry Wentz, and tonight that story is first at 5 o'clock. I spoke with a local pediatrician to learn more about RSV and what parents need to watch for.
The frustrating thing about RSV and a lot of these respiratory viruses is there's not effective treatment to kill it or shorten the course.
Dr. Jeremy Granger is a pediatrician with Unity Point Health. He's been seeing a rise in cases of RSV in Siouxland over the last few weeks.
September, we saw a lot of just regular respiratory viruses in hand, foot, and mouth. And then the last 2 to 3 weeks, we're seeing RSV, influenza.
Dr. Granger says most babies with RSV can be treated at home with nasal saline and Tylenol, and not all infants will require breathing treatments.
Not all children need breathing treatments, and in fact, sometimes it can make it worse. So if your kid is breathing comfortably, even if they're having a little bit of wheeze, we many times will not do any medicine because we at first want to do no harm.
For babies with a fever, Dr. Granger says sometimes a high and fluctuating fever is a good sign.
Fever is not necessarily bad, though. Fever can make you feel uncomfortable. It'll make you breathe hard and heavy and make your heart beat fast. It's a tool our body uses to kill off viruses.
But if the fever does get too high, it's best to see a doctor.
But if they have fever and they're uncomfortable, treat it. If they're over 104.5, they probably need to be seen.
And when it comes to nighttime care, have your child sleep on their back or even in your arms.
Nighttime is the worst, and generally days 3, 4, 5 are going to be your worst nights with RSV. So if you've made it past those nights, you're usually on the downhill slide.
And remember that with winter comes RSV season.
Everybody under the age of 2 gets RSV at least once. So even if you don't know that your child had it, they probably did at least once through the winter.
And if your child is sick, Dr. Granger says the best thing parents can do is trust their gut and seek medical care if you have any concerns.